Hi everyone, today we are going to learn about sickle cell disease. Sickle cell disease, also known as sickle cell anemia, is a severe hereditary form of anemia in which a mutated form of hemoglobin distorts red blood cells into a crescent or sickle shape under low oxygen conditions. Unlike normal blood cells, which are round and flexible, sickle cells are rigid and sticky. This abnormal shape makes it difficult for them to move smoothly through blood vessels, causing blockage that can lead to pain, organ damage, and a wide range of other complications. Symptoms of sickle cell disease are usually present from birth, though they often become apparent around 6 months of age. One of the hallmark features of the disease is anemia. Normal red blood cells have a lifespan of approximately 120 days, after which they are replaced by newly produced cells. Sickle cells, however, are fragile and typically last only 10 to 20 days. This accelerated destruction creates a chronic shortage of red blood cells known as anemia, which reduces the body's capacity to carry oxygen and leads to fatigue. Another major symptom is periodic episodes of extreme pain, known as pain crises. These occur when sickle-shaped red blood cells block blood flow through small vessels in the chest, abdomen, or joints. Pain crises vary in intensity and duration, lasting anywhere from a few hours to several days. Some patients may experience just a few crises per year, while others may endure a dozen or more. Severe crises often require hospitalization. Swelling of the hands and feet can occur when sickle red blood cells obstruct circulation in these extremities. Frequent infections are another concern because sickle cells can damage the spleen, an organ crucial for fighting infections. Children with sickle cell disease often receive vaccines and antibiotics to prevent life-threatening infections such as pneumonia. The disease can also impact growth and development. Since red blood cells supply oxygen and essential nutrients, a shortage can slow growth in children and delay puberty in teenagers. Vision problems may develop when sickle cells block the tiny vessels supplying blood to the retina, potentially leading to blindness over time. Sickle cell disease can result in numerous serious complications. Stroke may occur if sickle cell obstruct blood flow to the brain, presenting symptoms like seizures, limb weakness, speech difficulties, or loss of consciousness. Acute chest syndrome is a life-threatening condition caused by lung infections or blockage in pulmonary vessels, leading to chest pain, fever, and breathing difficulties. Avascular necrosis can arise when blocked vessels prevent adequate blood supply to bones, causing joint damage or bone death, most commonly in hip. Pulmonary hypertension, organ damage, splenic sequestration, leg ulcers, gallstones, priapism, deep vein thrombosis, and pregnancy-related complications are also associated with the disease. Sickle cell disease is inherited in an autosomal recessive pattern. People inherit 2 hemoglobin gene variants, one from each parent. The faulty hemoglobin gene, called hemoglobin S, causes the production of a defective hemoglobin protein. Inheriting 2 copies of this gene results in sickle cell disease, while inheriting one copy and one normal gene results in sickle cell trait. Carriers of sickle cell trait are generally asymptomatic but can pass the gene to their offspring. The mutation responsible for sickle cell disease involves a single amino acid substitution in the beta globin subunit of hemoglobin. Normally, the 6th amino acid is glutamic acid, but in sickle hemoglobin, it is replaced by valine. This small change dramatically alters hemoglobin's properties. Under low oxygen conditions, hemoglobin S molecules stick together, forming rigid polymers that distort red blood cells into the characteristic sickle shape. These polymerized cells are stiff and fragile, making them prone to rupture and causing blockage in microcirculation. Red cell destruction, or hemolysis, is central to the anemia observed in sickle cell disease. The body tries to compensate by increasing red blood cell production, often 5 to 10 times the normal rate, but it cannot fully keep up with the rapid breakdown of sickle cells. This imbalance contributes to chronic fatigue and other symptoms. The body's response to sickle cells can rather further exacerbate damage. Repeated polymerization and depolymerization of hemoglobin can release heme, with generating reactive oxygen species that harm red blood cells membranes. Membrane stiffness, protein clustering, and antibody formation amplify hemolysis and worsen anemia. Hematocrit values in patients with sickle cell disease are typically about half that of healthy individuals, though variation exists depending on the specific hemoglobin variants present. Sickle cell disease affects millions worldwide, particularly people of African, Middle Eastern, Mediterranean, Central and South American, and South Asian descent. The prevalence in the U.S. is highest among individuals of African ancestry, with about 1 in 365 black babies born with sickle cell disease, and roughly 1 in 13 carrying the trait. Interestingly, the sickle cell gene persists in regions historically affected by malaria because carriers with sickle cell trait have partial protection against severe malaria. Parasites that infect normal blood cells trigger sickling in trait carriers, which allow the immune system to clear the infected cells before the parasite can multiply, resulting in milder disease and higher survival rates. While sickle cell trait offers malaria protection, having full-blown sickle cell disease does not. Children with homozygous HBSS mutation are particularly vulnerable to malaria-related complications, highlighting the evolutionary trade-off. Carrying one defective gene provides a survival advantage in malaria endemic regions, but inheriting 2 copies results in serious and potentially life-threatening condition. Treatment for sickle cell disease focuses on symptom management and preventing complications. Hydroxyurea, an oral medication, reduces the sickling of red blood cells by stimulating the production of fetal hemoglobin, a type of hemoglobin normally present before birth that interferes with hemoglobin S polymerization. Other FDA-approved drugs include L-glutamine and crizanlizumab, TMCA, which target different aspects of the disease. Blood transfusions and antibiotics are commonly used, while bone marrow or stem cell transplants, and in some cases gene therapy, offer potential curative options. That's all for today on sickle cell disease. I hope you enjoyed this video. Don't forget to like and subscribe, and feel free to leave a comment if you have any questions. Thank you.